Can calcium supplement really makes your bone stronger and prevent fracture? First, let's understand how calcium works in our bone and how our bone mass changes as we age. Since we were born, we drink a lot of milk and eat a lot of high calcium food, and the calcium will be stored in our bone and thus our bone will be denser. However, when we reach 25 to 30 years old, we will reach our peak bone mass, which means that our bone mass is the highest at that moment. And after that, our bone mass will decrease naturally. That's why people say that we are shrinking as we are older. No matter how much high calcium food that you eat, it will still going downtrend. It's just that it will decrease slightly slower. That's why it's so important to eat a lot of high calcium food whenever you are young, because the more high calcium food that you eat, the bigger your calcium bank is, meaning higher peak bone mass. So if you eat a lot of high calcium food, your bone mass is here, okay? But if you don't eat a lot of high calcium food, your bone mass, your peak bone mass will just be here, okay, which is lower as compared to the others who take a lot of high calcium food. And you can see here, after menopause, women usually tend to have a higher risk of getting bone fracture, or we call it as osteoporosis, because after they hit menopause, their bone mass will reduce even more significantly. They can have bone fracture by just slight fall from standing. This is so dangerous as it might cause death. So back to the questions, can calcium help you to reduce your bone fracture risk? Study shows that calcium from supplements or from food will actually increase your bone mass by 1 to 2% over 1 to 5 years. Okay, and this slight increase will not be able to reduce the fracture risk. However, it do increase your bone mass. And the best prevention way is to make sure you have good intake of calcium, especially when you are young. Prevention is always better than cure.